Welcome to the Essential Trainer Mini-Sim demonstration. The Essential Trainer Mini-Sim is an extremely valuable tool for the practice of proper in-plane and out-of-plane needle placements, as well as visualizing target structures in various planes, such as cross-sectional, oblique, and longitudinal views. So let's get started. First, we apply gel on the Essential Trainer. Then we determine our probe orientation. This side will be towards us, and this side away from us. As we apply the transducer on the Essential Trainer, we can see two structures. The structure on the left of the screen is a nerve, and the structure on the right is a blood vessel. These two structures can be visualized either in a cross-sectional view, which is what we have right now, in an oblique view, which is what we see on the screen now, or they can be visualized in a longitudinal plane, which is accomplished by rotating the transducer head 90 degrees. Using this information, we can focus our training on how to obtain a clear view of the structures, where both walls of the blood vessel can be clearly visualized. Sliding the transducer close to us should get us back to the view of the nerve, which is right there in the longitudinal plane. Rotating the transducer 90 degrees once more returns us to the cross-sectional view. Both structures can now be very clearly seen in a cross-sectional view. Many procedures, such as arterial cannulation, are performed using a cross-sectional view. For example, if our goal is to reach the nerve, then we would insert the needle using an in-plane approach, where we start very carefully in order to see the needle passage through the tissue. As we view the needle passage, it gives us an opportunity to readjust the needle angle if necessary in order to reach the desired target, in this case, the nerve. At this point in the training, injection can take place. Visualization of the injection allows the operator to assure that the injectate surrounds the area around the nerve. Likewise, the nerve can also be reached with an out-of-plane technique. We begin by positioning our view of the nerve in the middle of the ultrasound screen. The needle is inserted maybe a centimeter away from the ultrasound transducer and passed through until the needle meets the ultrasound beam. In this situation, we can see the needle right there on the screen, and we can continue advancing the needle while sliding the transducer across the model until we get right next to the nerve where injection can take place. And again, practicing an injection on the Essential Trainer is a uniquely convenient means of learning how to inject the therapeutic or anesthetic agent around the nerve. In this next example, we will focus on a blood vessel. Vessels can also be accessed using an out-of-plane approach, similar to our demonstration earlier. Here, we see the needle encounters the vessel wall. If necessary, we can make an angle correction to ensure that the needle enters the lumen of the vessel, as seen here. Vessels can also be cannulated using an out-of-plane approach. First, we visualize the vessel in the plane, and then rotate the transducer 90 degrees to visualize both the anterior and the posterior walls of the vessel. Now the needle can be inserted in plane, starting approximately at the level of the transducer. And then we can guide the needle towards the vessel wall. And here we see how the needle enters the vessel wall. In summary, the Essential Trainer Mini-Sim is an important and valuable tool to learn ultrasound imaging of anatomical structures such as nerves and vessels in cross-sectional, oblique, or longitudinal planes, as well as to train the operator how to guide the needle towards those anatomical structures using either out-of-plane or in-plane techniques. The Essential Trainer also allows the student to learn how to inject fluid or local anesthetic around nerve structures, a skill that is very valuable in accomplishing successful and safe peripheral nerve blocks and vascular access. The presence of the tray is important as well because it allows any injectate to leak onto the tray without soiling the work surface. Using sterile water as the injectate allows for easy and safe cleanup after procedures.